Bloating seems to be something so many women, especially women in their late 30s to their 50s, come to me complaining about. They are so tired of looking pregnant or getting asked pregnant when they're not. Trust me, I get this. I've had a few rounds of bloating as well and know how frustrating this can be. Now, every woman doesn't have to bloat. In fact, I had a patient not too long ago who told me one of her doctors said, everyone over 40 bloats, there's nothing you can do about it. That's simply not true. We need to understand what's happening with bloating, and then we can actually get some answers. Here is essentially what's going on. As estrogen levels shift and we all start to store more estrogen, we call this concept estrogen dominance, and I talk about estrogen dominance in this video right here, we can actually start to have more bloating, and here is why. The hormones and the hormone balance impacts our gut health. The gut, remember, is a factory of lots of different bacteria and enzymes that are working together to make sure our body is doing what it's supposed to do. That means it's supposed to take the food we eat, chop it all up, factor it all the way down to wherever it needs to go, and everyone should be happy. But with the hormone shift, especially a shift towards estrogen dominance, we know that bloating happens frequently because the microbiome, or all those bacteria in the gut, shift and change. But here's what you can do about those shifts and changes. First of all, we want to manage the basic concept of estrogen dominance. There's so many different things you can do, but let's start with food, because really food is the foundation for many of these different hormone patterns. The first thing we want to do is really up the fiber. We know that more fiber, soluble fiber and insoluble fiber, helps with bloating. So adding in things like ground flax seeds, adding in psyllium husk to your daily diet will help you with the general concepts around bloating. Cruciferous vegetables add fiber, but they also help us to metabolize estrogen better. They take estrogen, chop it up, and push it out of your body. So getting in about 5 to 6 servings of cruciferous vegetables every week is helpful for estrogen dominance. So bringing those into the equation, I think, really does make a really big difference when it comes to bloating. All right, next, we have to talk about the things that we are all doing, myself included, to make us bloat. One is the caffeine habit. So many of us, first thing in the morning, mine is tea, yours might be coffee, whatever it is, excessive amounts of caffeine can actually trigger bloating. So that's one to watch and stay on top of. Try to limit your caffeine to maybe a serving, 2 at the most on any given day. The second is dehydration, not drinking enough water. That can actually lead to bloating as well. So make sure you're drinking about your body weight. If you'll take your body weight, think about drinking about half of that in water every single day. Then you get to roughly the right amount of water for you to take in. Next, and here's where hopefully we don't have a fight, we have to cut down the amount of alcohol. Alcohol actually triggers an overgrowth of yeast or candida in the gut, shifts the microbiome in that direction. You're more susceptible to it when your estrogen levels are all over the place. So drinking, as the patient told me the other day, 10 ounces of wine every night, even if it's a high quality wine, is going to trigger bloating. So pulling back on that, limiting it to about 2 drinks a week, ideally no more than 4, that's going to help you in sort of this whole protocol around beating bloating. All right, so we've talked about what we can do just from a food standpoint, but there's so much more. In addition to that, remember, consistent sleep, not sleeping through the night, contributes to bloating. Cortisol and stress hormones contribute to bloating as well. Have you ever had a week or a month where it's just one thing after another hitting you, and all of a sudden, at the end of that month, you've got a belly? I know I've been there over and over again. And that is the testament to high cortisol and stress really impacting your overall digestive health and your microbiome. Now, there's another factor that plays into this beyond stress and sleep. We know that movement is going to help influence what the microbiome is doing and your digestive capacity. When the hormones shift, here's another sort of technical conversation that we probably need to have. The ability of our liver and our gallbladder to produce bile, which binds up fat and then delivers that where it needs to go, actually goes down. So many women have bloating because they have fat malabsorption. The liver and the gallbladder aren't doing the work they're supposed to do. So for those patients, I'm often advising them to take a digestive enzyme, something with lipase in it to help break fats down a little bit more effectively. All right, so that brings us, let's say you've done all of that. You've tried it all, and I know you're gonna DM me or leave a comment that I did that, it didn't work. Where do I go next if you're a patient in practice? Well, I go to using things that I know help with estrogen dominance. So I love using calcium glucarate or DIM. These are compounds that actually help us to break estrogen down a little bit better and indirectly support the liver. And as we get more of that estrogen breakdown and liver support, we help the microbiome balance out to where it needs to be. In addition to that, I love using probiotics. In fact, one of my products I developed called the Belly Fix is a combination of probiotics, prebiotics, glutamine, many of these compounds that help the gut manage all the hormone shifts that are actually happening throughout the body.
So if you're dealing with bloating, please don't accept the answer that there's nothing you can do or that it's normal. Understand that you're probably having a hormone shift, that hormone shift is triggering a gut shift, and both of those need to be managed to really help you beat bloating. All right, I post new videos every week. Don't forget to like and subscribe.